Welcome, Buttercups. It's good to see all of you. I'm glad you've joined us for a live episode tonight. I haven't feel like I haven't seen you guys for a little while. Just as a reminder, with Topic Discuss, you can not only can you subscribe to our channel, but you can, next to the subscribe button, you can actually see the join button. And so if you join Topic Discuss, then you can actually join our membership. Tier 1 members become Butters. Tier 2 members are Cups. And Tier 3, the most exclusive membership, is Buttercup. So if you want to be a true Buttercup, then you need to join the Tier 3 level. So I just encourage you all to join Topic Discuss and obviously to share and like and make comments. This is going to be a live show with a special guest. So we will take comments, and I'll be moderating those, as well as some other people behind the scenes. So in all seriousness, with tonight's show, I want to just provide a little bit of context and sensitivity. I'd actually really want to dedicate this show. If I can, I'd like to dedicate the show to a special individual in my life who 10 to 15 years ago experienced transgender, transition, and just to maintain, confidentiality and anonymity. But that individual knows who they are, and this episode is dedicated to you. So our special guest tonight is Adam, and I'll let him introduce himself. We're going to learn lots of things about the transgender community, and probably more specifically the transition process and why that's important. But I do just want to say, out of my own experience, this is a sensitive topic, and I will require lots of empathy and respect as we enjoy this evening together. So buckle up, Buttercups. It's another episode of Topic Discuss, and I'll introduce to you Adam.
Hi, how are you doing?
Adam, great. How are you?
I'm doing pretty good. I'm a little nervous, but we're good. I'm doing a good job.
Okay. Well, yeah, this is very relaxing, Adam, and I'm really grateful that you're with us. So no need to be nervous, but at any point in time, we can end the interview, and I have a pretty small following, so it's not like you're going to be exposed to thousands of people.
Nah, it's all good.
So Adam, maybe if you wouldn't mind just introducing yourself, whatever you feel comfortable with. I feel bad because I actually don't know how to say your last name, and I'm wondering.
It's Godden. It's literally just pronounced Godden.
Okay.
It's French, so.
It's French.
Yeah.
Cool.
It's just spelled differently in France, and then when we came across during the Revolution, we changed the name.
Okay.
So, interesting family history with Adam. Okay, yeah. So I'm Adam Godden. I'm 21. I'm a senior at Dixie State University. I was recently accepted to be matriculated into the University of Utah School of Medicine, and I'm transgender. So
we have some things in common with transgender issues, and also with medicine.
Yeah,
that's great. I didn't realize that you had been accepted into the So are you in the pre-med program at the university?
At Dixie,
were you
or
in the
at
pre-med club? Yeah.
So I did a whole lot of stuff. So I did Root Scholars over the summer. I think it's called it's no longer called Rural Health Scholars. I think it's Utah Health Scholars or something. I was in that. Yeah. And then I was part of DPMA in Shriners Hospital through my undergrad as well.
See, I helped Doug start DPMA. And so that's why I'm asking,
yeah, I love Doug.
Yeah, I do too. He's great. So
yeah, Doug was actually the first person that I told that I was accepted to the U. So,
well, Adam, I'll give you a little something that'll be kind of exciting. So part of my job, in my real life, outside of this hobby of mine, one of my accountabilities is the residency programs. So
Nice.
from the University of Utah. So I help with that whole process. When you're ready to be a resident, we'll stay conneced, and I'll help guide you wherever I can. I'd be happy to do that.
I'll see you in like 3 or 4 years again then. Just pop back on.
Have you taken the MCAT?
Yeah, I took the MCAT. I took the MCAT in March of this
because you were
year.
accepted.
Yeah, hopefully I've taken the MCAT already.
That was a stupid question.
No, we're all good. I did early acceptance, which is why I already know. I was very lucky that it paid off, that I did early app. So
you are a up and coming medical student?
Sure am. Submitted the background check and everything. It's official.
And you passed?
Yes, I did.
So where are you from, Adam?
I'm from downtown Salt Lake City. I grew up downtown Salt Lake City for my whole life until I was 18, and then I came down to St. George.
And what brought you to St. George?
A whole host of things. Mostly my home life was really chaotic all through high school. And so Dixie was the farthest I could get away while still paying in-state tuition. It was really crazy that I came here at all because I had no idea what I was doing. I just knew I wanted to get into medicine. And I had a friend that was like, well, I'm doing the athletic training program. Come down for a semester, see how you like it. And then I came in for my freshman semester and Doug snatched me up. And the rest is kind of history there. He got me into all of these pre-med programs and I was just pretty much a straight shot from there.
So again, I want to make sure that, if any of my questions make you uncomfortable, stop me.
No, you're good. You're good.
So when did you begin to recognize that you were transgender? And I recognize, I mean, the individual that's close to me in my life that went through this experience, that it was almost 15 years ago, and we did not have resources as a family. And this individual who I love and respect so much just was, I actually had a conversation with that person. I'm trying to maintain anonymity before we got on the call, just to kind of remember and recall, and I do remember this individual had, there were these bits and pieces throughout their childhood where they knew that there was something different, but they couldn't articulate it. And so whatever you're comfortable with, I think it's important for society and community to understand how core to who you are this really is, right? This is not some kind of a political trend, or I don't know what people say.
I love being a political trend. It's very good.
Right, like you just decide to completely overturn your life for a political trend, but
it's super fun.
So whatever you're comfortable sharing, we'd love to hear.
Yeah, so I'm kind of boring actually. So I grew up LDS. I grew up in the church. I was Young Women's Stake president for a long time. I didn't even know what a gay person was until I was probably 11 or 12. Had no idea that was a thing that you could do. And I had all these feelings, but I didn't have a word for it because I grew up a little bit sheltered. Even though I was in downtown Salt Lake, I just grew up being I wish I was my father's son. I saw the way that my younger brother was treated, how he got to do football, he got to do all this stuff. And I was just pissed because I just wanted to do it so bad and I couldn't understand why I wasn't allowed to do it. And I remember just being so angry over I was making all these plans. I initially wanted to go into the military and do a bunch of stuff with being a woman and proving that I was just as good as men. And I didn't have a term for it. I didn't understand why I was so fixated on being just as good as men. Or proving that I was one of the boys or something like that. I was actually at girls' camp, and one of the leaders had brought a New York Times or some kind of magazine And it had a story in there about a trans man named Alex. And I remember like looking at it and nothing clicked, but I like stole it. Like I stole it from her and like kept it in my like tent. I don't even think I've ever told anyone this. I totally stole this magazine and I kept it in my tent and I just read this like 2-page story like over and over again. And then I took it home, I squirreled it away and I like shoved it under my mattress and I went, wow, what a crazy story. That has nothing to do with me and I'm never going to think about it again.
So I'd love to, how did you feel when you read that article? Can you remember? And what was?
I think I cried and I couldn't figure out why. And I was like angry why there was like such disconnect. I felt like there was just like a missing link. And it was just me being 12, you know, I was literally like 12 years old, and not realizing that that was an option. Like they can do it, but I couldn't do that. That's not me. That's not something that I'm going to do. And I think it was literally like the summer in between like 7th and 8th grade, I heard like the term like transgender outside of that for the first time, like used in real life. And from then it was like late night, like waking up at like 2 a.m., making sure my parents were asleep, going onto the family computer, like doing like what I thought was research, you know, at 13 years old.
Yeah.
Yeah. And then like frantically wiping the history and then going back to sleep and then waking up and going to like 8th grade. But I think I came out like first or second week of 8th grade. So I was 13. So I've been socially transitioned since I was 13 years old.
So I'll just say this, because a clarifying point, I think, is, you know, a young girl growing up who wants to participate in sports and military, that doesn't necessarily mean
it doesn't mean transgender.
But you, through your experience, that was more heightened. There was a disconnect, a missing chain, and anger.
Yeah.
I think the one thing that is interesting to hear you say is just how much anger you felt, you know, about your life.
Yeah. It was a little rough. It was mostly, I think, externalized grief over what I felt like I was missing out on. So it's not like I'm like jealous necessarily of like my brothers but I'm the oldest of 4. And so watching my brothers get to go, you know, do football. I know that football is like a big contention, but like in my family, that's what we did. My dad was football coach for East High for like 6 or 7 years.
Because you could have played football.
I could have, but I wasn't allowed. I couldn't figure out why, and I was really mad about it. And I just felt like my family would like me more if I was just a boy. And it wasn't like I felt pressure to be a boy. It's just that like I would like sit down and I'd be like, I just feel like this would all be better if I was a boy. And there was nothing necessarily wrong. Like it wasn't like I was being treated badly because I was being treated like a woman or anything like that. It was just me being like, if I could be a boy right now, I would. But I'm not going to think about that anymore. And then I'd like go about my day because I'm 12, you know. But it was very.
The person the individual in my life that I've had this experience with, they definitely had, and I don't know what the right word is. I don't want to say anxiety, depression. That certainly
Dysphoria.
Was there. Yeah, dysphoria. And I'm glad you used that word because I use dysphoria. That's really where I learned like so much about this through my family member, but just also the research around dysphoria. But I didn't know I could say that anymore because I said it at a gay pride like support meeting and I got rebuked. So can you say dysphoria?
I mean, queer people aren't a monolith. Dysphoria is used pretty frequently in my trans circles. It's not a requirement for being trans, but a lot of trans people do experience dysphoria. I experience like crazy dysphoria. That's what's pushing me to like medically transition, you know? Um,
Yeah, because the dysphoria through what I experienced with my family member is that the dysphoria becomes so severe that like your risk for suicidality and actually killing yourself
yeah.
really like increases. I think I saw some research that it's like 30 to 50% increase in
Yeah.
suicidality. Did you experience that?
Oh, yeah.
And feel comfortable with what you want
Yeah.
to share. I
No,
know
it's
it's
important.
sensitive.
So it's really sad that trans youth are kind of not even stigmatized, but just known for how suicidal they are, because the when you don't have terminology for being transgender, you just think that you're wrong. You just think that nobody else is like this and you are alone and you just need to fix it. You just need to move on and get over yourself, and you can't even figure out what you're supposed to be getting over. And so for me personally, it like manifested in like really hard religious trauma and feeling like I didn't fit because I was like too hypersexualized, or that I was like too like I wasn't supposed to look the way that I was looking because it wasn't godly, because it wasn't appropriate, or because it wasn't modest. And so that was how my dysphoria manifested, because that was the terminology that I had access to, if that makes sense. But literally
Yeah,
the instant that a single adult, which ended up being like my freshman in high school, like art teacher, called me Adam for the first time, that was like all of that like didn't disappear, but it was like mostly mitigated. Like it was just one person who believed me, and that's all that it took for most of that to just disappear.
yeah, and for the audience, I think the other thing too is there is such a very distinct uh, um, paradigm regarding dysphoria. You may be an individual with depression and suicidal thoughts, and medication, like an antidepressant or
Mm-hmm.
anti-anxiolytic, can be completely transformative, and
Yeah.
that resolves those issues. In dysphoria, though, you often will not have any resolution
Yeah.
from
There's
an
no
antidepressant.
resolution. Yeah.
And the research, I just want to also be really clear with my audience, because I personally understand this research. You can also we'll share information in the description below, but there is only one pathway for dysphoria, and it is, correct me if I'm wrong, Adam, but it is the option to take the steps towards transition in a way that's comfortable for the individual, right? So there may just be medical transition, and to some point that may resolve the dysphoria and that may be the extent without doing surgeries. Maybe later in life, surgery and gender realignment or reassignment surgeries might
Hmm.
come into play, but it is so individualized. But the resolution of the dysphoria is very complex. It is not just like we'll take an antidepressant and start exercising.
Yeah. So I am actually one of those people where I have both. So I'm bipolar. It's like a familial bipolar disorder. I have bipolar type 2. So like even though my bipolar disorder is treated, like it will or treat is being treated, it's in the process. It's a forever thing, you know. It's not, it's like separate from dysphoria. And dysphoria, once again, like you said, has so many different facets. So there's like social dysphoria, body dysphoria, like
Mm-hmm.
dysphoria that like follows you, and a bunch of other things. Like the other day, I got dysphoria about like how my calves looked, because I was like, that's not how a man looks. And it was so ridiculous, because it's literally just your brain trying to point out how your body or how like your experience in society is different than how it thinks it's supposed to be. So that can be solved by like medical transitioning, which like also is a lot of different things. It's surgeries, it's HRT, which we're talking about like right now. It's assisting like devices, so like chest binders or like prosthetics, things like that. But it also, with social dysphoria, can just be people perceiving you uh, by the gender that you want. So like, I don't really have social dysphoria anymore because people just perceive me as a male. I'm in spaces where I am consistently gendered correctly. People use my name. The social dysphoria aspect is kind of non-existent now, especially now that I've kind of been like, not like credible, but like the University of Utah accepted me underneath the name Adam. So like, there's not really any social dysphoria for me personally because I am recognized by who I am.
So again, correct me if I'm wrong, but across that spectrum, for some individuals, the social dysphoria, resolving the social dysphoria with ensuring we have correct pronouns, ensuring we have correct names, could be some people might stop there. And maybe later on in life they'll need to take some other steps. I don't want to make it sound like you've checked this mark and now you're good. I mean, it's fluid.
Then you're done.
No, yeah, but I just want to like highlight for the audience, there is an underlying medical component. We understand this so much better than we used to. We understand treatment modalities. There are plans. This is not just, there are treatment plans. This is not just, I get very, very frustrated whenever I hear anyone say, well, this is, like I said, it's a political trend, or that it's just social, or, I don't know. I don't even want to try to say what people say because it does bother me. This is a real manifestation. Dysphoria is debilitating. It's debilitating, and it can cause death.
Yeah. I also would like to point out that I don't think that those people understand just how hard medical transition is and just how long it takes. It's not like I wake up and I'm like, all right, I'm going to be on testosterone today. Even though I, in the state of Utah, could technically get informed consent through Dr. Lucanar, who is one of the only doctors in like the U, essentially, like the state of Utah, that will do informed consent. It took me 4.5 months. And that was after I got, a letter from my psychiatrist saying that I'm really transgender, and like doing all this blood work, and I have to pay all this money because it's not covered by insurance. Like, it's not like I wake up one day and I'm like, I would like to be transgender today. And then boom, I have like all of these surgeries lined up, It's taken me,
and the hormones.
It's taken me 10 years to get to the point where I can medically transition. And then once I did finally have the money and like the insurance checking boxes and stuff, it still took me over almost half a year to get on testosterone. And then to keep that medical component, I have to go back every 3 to 6 months for the rest of my life. Like, it's something that I actively have to fight for.
Yeah. I think that's the other thing that I want to advocate for. Just as coming from healthcare myself, I am very. It's very important that all individuals have full access to healthcare.
Yeah.
And this is a real problem. I mean, we have a problem with access to healthcare, period, for the general public, but for the, for kind of the disenfranchised or the kind of forgotten groups or specialty groups, you do need, as a transgender person, very specific medical care, and it is medical care. Going through transition is medical treatment and should be covered by insurance. Anyway.
Yeah. I think that
and
then sorry,
Adam, I have comments from viewers, but I'm screening them, and I don't know if they're your friends or family. So do you know Navi?
Navi. I think that they are from like DSU LGBT. I know that Dr. Davis like boosted this to like all of STEM. Yeah, Navi. I do know Navi. Okay. Yeah. It is, testosterone is a controlled substance compared to estrogen. Yes, it is. My testosterone is not covered by insurance. I pay for testosterone by the vial. So that's completely true.
For our audience, just education wise, would you consider, is it appropriate to say you're a trans man or trans men?
I'm a trans man.
So
I was assigned female at birth, and now I am trans masculine. Yeah.
So in this comment, it's a lot tougher on trans men. So testosterone's tougher on you in terms of getting approval for it, or physically. I think that's the other thing that we'll hear about from you today is how is it physically and mentally, emotionally? So go ahead.
It is a lot harder because, and I get why. It's because technically, testosterone is a controlled substance because it's not like you're doing estrogen for like bodybuilding competitions. You're not trying to get black market estrogen for like steroid use or anything. I totally get that. I get why testosterone is a controlled substance. But like I mentioned before, without informed consent, you have to have a therapist that will give you a little letter of recommendation for hormone therapy that basically is a little letter that says, I promise this person isn't crazy. They really are transgender. They proved it to me. And it's usually a cisgender doctor that's like giving you the seal of approval, which I don't know how they would know, if I'm faking it or not. Or why I would be faking it to get testosterone, and then you have to go and then you have another full interview with the doctor. I've been rejected from my general practitioner for HRT, which technically they're allowed to do. They can say, I'm not going to do this. I can refer you out, and then they never refer you out. So Dr. Lucanar is based in Salt Lake at, I think it's like Rebirth OBGYN, and they are like the only doctor in the state of Utah that will do informed consent besides Planned Parenthood, and Planned Parenthood is not really in Utah for HRT. So it is a lot.
Tell us, teach us what do you mean by informed consent?
Informed consent is when you say, you go to a doctor and the doctor is like, I have access to HRT. There it is. And you say, I'm transgender. And they say, all right, here is the list of all the side effects of testosterone, social, mental, physical. Sign your name here. You are now fully informed. You have informed consent of what you're doing to your body. Here's testosterone, or here's estrogen. Here are these HRT medications, as opposed to having to go to a psychiatrist and the psychiatrist having to like write you off legally as being sane and actually transgender.
So you can see another comment from Navi.
Todd Magnum for HRT. I do like Dr. Magnum. He's very funny.
So I'd like to just like go back to social dysphoria began to be resolved. And this is, I've had a few people that I work with who say, why is it important to include your pronouns, right? He, him, for me, when I got my email, or it is because it helps with this dysphoria, social dysphoria.
It helps
in
normalize.
Some ways, it's a public health issue. Yeah. So you began to resolve that social dysphoria, but you had other dysphoria that you needed to work through. What dysphoria led you to HRT?
Wow, a lifetime of just experience at this point. Like I said, I came out when I was maybe 13 or 14, like literally like middle school. I was like, oh, it all makes sense. I'll give it a little bit. And then I was 16 and I was still trans and I was like, oh, I'll give it a little bit. Essentially, I would have gone on HRT. I would have gone on puberty blockers, which is not HRT, but puberty blockers basically halts first puberty. So it would halt like all estrogen production and everything. I would have done that if it was acceptable within my family to do so, but it wasn't. So basically, the dysphoria that led me to do it was being forced to go through.
Could your parents have facilitated that?
Yeah,
as your guardians?
Legally, they could have started me on testosterone at the age of 15 or 16. They could have done puberty blockers at age 12. Both of those things are entirely legal with guardian like permission, essentially. But what basically gave me dysphoria was being forced to go in the opposite direction. Like the farther to womanhood, or like the idea and appearance of womanhood that I got, the more that I was like, hey, is there brakes on this thing? I would like to go back. Because as that became more and more apparent, as I was being treated more and more like a woman, it wasn't like, oh, this is like a feminism thing. It was, this feels so wrong. I hate this. And then technically the dysphoria didn't push me to do anything. It was the euphoria of being treated as a man that made me understand that that was the right way to be going. Because just feeling trash about my body all the time didn't give me any information on what I should be doing to like make it feel better, you know? It was only when I was being called Adam that I was like, oh, this feels really good. This feels right. This feels, and it's not a super common experience for trans people to pick one name and stick with it, but I did. I don't know. I got it right on the first time, I guess. But as soon as I heard like the name Adam, as soon as I started being called Adam, as soon as I got like my first chest binder, it was like, yep, this is right. And it's never wavered since then. So that was pretty much what made me start like medically transitioning, because I was looking at like before and afters at like 14, you know, like under my covers on like the family computer or whatever, and being like, oh, I want that. That seems so right. I want to do that. Mm-hmm. So it was the euphoria of being perceived. Yeah.
It's this stark difference, right? It's this wide gap that is fulfilled.
Yeah.
So when did you start HRT?
I am 6 weeks on HRT right now. So I'm pretty early on.
So this is an opportunity to really dive into what you want to say about HRT and your experience.
So first thing I want to say is that HRT is 100% medical care, as you said, A, and B, it's absolutely life-saving. This was a life-saving intervention, genuinely for me. I don't know what I would have done if I knew I could not get on testosterone. That was basically the only thing that was keeping me going through all of like high school and everything. Was as soon as I move out and I have the money, I can do this. Like I can get top surgery. I can finally live the way that I want to live. And if I knew for a fact that that wasn't going to be an option for me, I would not have survived high school. That is just 100% true. I had, and like content warning for, you know, suicidal ideation and stuff, because that can get a little dark if people get jumped on. But like right after I came out and was initially rejected for it, I died. I was dead for like 2 minutes after a suicide attempt in 2014. I was 13 years old. I think it was like the week before my 14th birthday. And then when I was rejected and kicked out, my junior year of high school, I tried to attempt suicide again.
Was that rejection because your parents didn't support the transition, or because medically it wasn't supported?
Both. It was mostly just my parents being like, this is evil and this is awful and this is something that should never be talked about. This is something that you need to fix. You are mentally ill. Like you are disturbed for this. And my parents, like, they love me, or they think that they love me, and they will support me with literally anything except for this. You know, it's not like they were like, I don't know. I don't even know what to say about that, because it's so messy, you know, emotionally and physically. But yeah.
So just for the audience, this is so, I really want to press this point home, right? We have access to healthcare. We're much better at this. We didn't used to be. We do have access to healthcare for antidepressants therapy for people with depression and anxiety, and it is life-saving. You know, people who have experienced the resolution that an antidepressant, an SSRI, for example, will bring to their soul and to their heart, and it saves their life.
Yeah.
This really is about saving life. And I use the example of an SSRI because in transgender dysphoria or gender dysphoria, it is just as, in fact, it's more life-threatening. It is more life-threatening. Suicidality, I mean, we've heard of 2 attempts here on this particular case. We have to support the right medical treatment plans that we know work for mitigating that risk. So this is I just want to I want our audience to really lean into what we're talking about here. We're not talking about anything else except for medical care, life-saving treatment, and saving lives. But not just saving lives, but really ensuring that we have, all of the resources that people like Adam need in order to thrive in society and contribute. Because here's what's going to happen with Adam. Adam is going to become a physician. And as a physician, Adam is going to help many more people that we haven't been helping. Anyway, so this is just so important. You had some very frightening experiences as a young girl.
Yeah. Well, I mean, I was out by then, so I was a boy.
Oh, a young boy. Sorry,
a young Adam. But
a young Adam. I forgot you were
good.
trans by 13.
We're good. Yeah, it's pre-transition, post-transition for sure. But yeah, this is absolutely life-saving, knowing that it was even a chance that I could get on HRT. It wasn't even like the assurance that I could have this intervention. It was the chance that I could have it was the only thing that kept me going, straight up.
So how old are you?
I'm 21.
And you just barely got started on HRT,
yeah.
So that's a long time.
Yeah. I will admit it wasn't like, it was about 6 months for my HRT from like initial consult to getting on it. My biggest issue with starting HRT was actually fear of never talking to my family again. It was fear of like social outcasts. It was being like, are my parents right? Am I going to be on HRT and irreversibly ruin my body, even though that's just straight up transphobia? I'm not ruining my body. I am aligning it with how I know it should be. But it was fear of never seeing my siblings again, or being, not loved anymore by my family and no longer having a community. When I came back up to Salt Lake for medical school, it wasn't like anything else besides that. It was me finally deciding to choose my needs over societal wants.
So when you started 6 weeks ago, for the audience, what's the technical, whatever you're comfortable sharing, is it an injection? Do you go to the doctor? Do you give yourself an injection? Is it a pill?
Okay, there's a ton of different types of tea. So you technically could take a pill. I don't think that most of the people I know in Utah take pills. You can have a like topical gel that you can put on and like leave, and then you do that like once or twice a week, I think. And then I think that technically the FDA hasn't approved it, but in other like countries they do like almost like depot shots, like it's like every 3 months in the arm. I do weekly intramuscular injections. They can also be subcutaneous, but I find the intramuscular works a little bit better for me. So I don't know if people know what that means. But
Self-administered?
The first 2 times they were not. I chickened out and got my very good friend Esme to do it for me because they're a medical assistant, so they knew how to do it. But these last 2 times I've bucked up and I've done it myself. But so yeah,
teach us the difference between sub-Q and intramuscular.
Sub-Q it's a much smaller needle. It's a lot more. It's a lot easier to palate because it's like 1/2 inch. You stick it into like stomach, arm, just like anything right below the skin. Intramuscular
like insulin.
Like insulin. Intramuscular is the scariest needle alive. It's like 1.5 inches long. I think I inject with 18s, anywhere from 18 to 21s. They're a little thick.
Oh
they're a little big.
Yeah. 18 gauge are huge, audience. Yeah. that is scary.
And this is coming from someone that like had to go to like a therapist as a child to talk about my fear of needles. So like, I can't really be faking being trans at this point because there's no way.
You're self-administering 18 gauge?
Yeah, 1.5 inches. Intramuscular.
You are brave.
Yeah, I actually am looking at my Moana Band-Aid on my thigh right now for my injection today. So it's pretty good.
And are they once a week?
They're once a week. I do them on Fridays. It's just any day,
So we're going to take a couple comments just real quick. I think this is helpful with oral testosterone. It's hard on the liver, so we may not, and it doesn't have a good conversion rate. So maybe that's why oral's not used. Have you heard that? Adam?
Yeah. That's why I do intramuscular instead of sub-Q, because I also heard that sub-Q is harder on the liver and sometimes like the kidneys and some other things. So I do intramuscular, even though I hate it, even though it's very scary, because it doesn't lock me up as much. I feel better about it. It circulates a lot better. Also, testosterone is an oil-based like medication. So it takes a minute to administer. You can't just like one and done it. Like I have to, over the course of like 30 seconds or so, slowly inject it in. And so I find that it absorbs a lot better intramuscularly.
Yeah, it's slow to push out. You can't just push it out in one.
That's why I'm using those 18s, because if I was like using like a 25 or something, I'd be there for a half an hour, you know?
So do you feel different, or is it kind of build up over time?
It does build up over time. So do you remember what it was like to be a 13-year-old boy? That is essentially what I'm doing right now.
And I have a 13-year-old son.
Yeah. Just like that exact same emotional like scale. I am just 13. It's second puberty. It's great.
Well, so does that, let's just do the thought experiment, and I'll hearken to my 13-year-old son.
Yeah.
So is there a little so there's easily distracted?
Yeah. Yeah. It's easily distracted with quotation marks. I've never been this angry in my whole life. I very, very quick to anger. I have a lot of road rage. I mean, like emotionally, I'm also like way less depressed. I feel great.
Mm-hmm.
I have so much more energy. I'm getting pretty yoked out in the gym now. Like I'm building muscle really easily.
And how does that feel to build muscle?
It feels so good. It feels so nice because now I can do crazy yoga poses that are super impressive and stuff. So I'm doing that. I think Dr. Davis, who you know, Dr. Aaron Davis, he's my research coordinator and my research father, essentially. He's like, wow, your voice has changed. And I was like, really? So I'm 6 weeks on, so my voice drop is starting to happen just a little bit. Right now, it just kind of sounds like I was screaming a lot, but it's a little bit raspier, a little bit lower. That should hit in the next month or so. Everyone can make fun of me for my voice squeaking. But yeah, I have a lot more.
For the audience, and for the audience, there is a difference in female to male transition. Testosterone is very different, obviously, than estrogen. It's extremely powerful. So if we did an interview with you, Adam, 18 months from now, your voice would be completely different. Yeah,
I'd probably have an ugly little beard too. It'd be great.
It's an incredible. It's an incredible transition. It's powerful.
Yeah. I already have like fat redistribution, so I'm getting a little bit more of a gut, but you know, it's okay. It's fine. I'm a little bit too early for like hair changes, hair pattern changes or anything. But looking at the rest of my family, I probably should enjoy my hair while it lasts. Yeah, I'm about to
hey, listen, this is a good style, okay?
Yeah, it'll be good. I'll look cute in my little lab coat with no hair. But yeah, besides that, it's a little bit too early for anything besides like emotional changes. So, you know, road rage, feeling like way more energetic. Like I don't have crazy depressive spells. I feel a lot better in the gym. I just emotionally feel a lot better, but that probably is just the gender euphoria and feeling like really content with my body. And also it doesn't hurt that like testosterone's kind of making me like, I can just go like all day. I'm not tired anymore. It's very helpful in that sense where I just am very motivated and very able to go out and do things. So
do you maybe educate the audience on how long the HRT goes for? Does it change in dose or frequency over the next few months or years?
Okay.
What's your treatment plan?
It's all up to me, essentially. So right now I'm on 0.4 milliliters once a week. I have to go in December and get blood work done to see if my hematocrit levels, which like is thickening of the blood essentially, because when you replace all that estrogen with testosterone, I have a higher chance of heart disease, heart attacks, because men have a higher chance of heart disease, heart attacks. I have a family history of high cholesterol, so I'm currently on the keto diet because I gotta cut down on the carbs, stuff like that. But until I check in, that's what my treatment plan is 0.4 with an 18 gauge needle once weekly intramuscular. Past then, I essentially take HRT forever. Like the instant that I stop taking testosterone, I'm going to start taking it, like producing estrogen again. And if I, get a hysterectomy or something, I won't be making anything, and that won't be good for me. So I am essentially going to be taking testosterone in some form or another for the rest of my life. That's just a fact. That dose might go up if my blood is like good. If like the blood results are good in December, they might stay the same. If I'm like progressing pretty good, if I, in December, I'm like, all right, I'm getting a little nervous, I want to slow down my transition, they can drop it so that the changes happen slower, But right now, that's pretty much my treatment plan.
I know this doesn't happen very often, but if you got to a point, you could say, actually, I don't want to transition. I'm not, this isn't working. You have that option too, right?
Yeah. So like emotionally and like within like my community of like transgender people, that's like detransition is sometimes perceived as scary, but like it's something that happens, or people might be like, hey, I thought I was, female to male transgender, but I'm non-binary and I don't want to like go and like stay within this realm of masculinity. I like being somewhere in the middle, or maybe I was just experiencing like internalized misogyny and I like she, her pronouns still. It's not stuck at all. It's like with all other forms of dysphoria and transition, like I can play with it as I want because it's my body and my experience. I don't super plan on doing that. I've been pretty stuck on one course for about a decade now, so I don't think it's a social or political trend at this point. I'm kind of stuck in this. I've put my peg in there, but yeah, that's pretty much my transition / treatment plan for the rest of my life is intramuscular injections once a week.
I think that this is just kind of another important component to recognize is supporting people through, the various stages of life. You as you age and as you have other experiences, you'll change again. And I think what we can do as society is help support each other through all of those various transitions, whether it's, dysphoria or other things, right? It is just part of, and it's okay. It's okay to say, you know what, I this wasn't for me. I feel more, content just with non-binary. And what's important for us as friends and family is to unconditionally love, support, and never like layer on your experience onto someone else.
Yeah. I am a binary white passing trans man. Like pretty much the only thing that in like 2 years you're going to be able to clock me for, and clocking is a term where like you can tell that someone's transgender, is that I'm 5'2". People are going to look at me and be like, that's a very short bodybuilder. And that's pretty much it. Like I have a whole lot of privilege actually as a transgender person I'm not a Black trans woman, I am fairly well-to-do, especially now that I'm going to medical school, I have a whole lot of things going for me in that regard. And so my experience is super rare that I, within a year of like questioning myself, knew when I was younger that I have even access, I have money to pay for these hormones, that if I want to, I can technically, get a loan to pay for surgeries if I want, that my partner accepts me, that I have chosen family. Like very lucky of me. It shouldn't have to be, but it is very lucky of me that I have that. So it's not the typical trans experience at all. I'm kind of a little poster child for it.
Yeah, and I think for education purposes, you're in the medical stage. When we say medical transition, that's hormone therapy. We're using, non-surgical intervention.
Yeah.
Do you think ahead about surgical interventions, or
Every
is that
day.
too far away?
Every
you do?
day I think about it. Top surgery, which is like, mastectomy for transmasculine people, is a lot harder to get than hormone therapy. It depends on the state. Some states require you to be on hormone therapy or living as your authentic self for a year. Most, insurances refuse to cover it. It's about $10,000 out of pocket, and that's just for the surgery. You can get on a ton of other things like scholarships with the U. I know that like the U of U Trans Health does like scholarships and like surgery giveaways and stuff, but that's not the case for most people. So top surgery is a little bit of a plan out. It's like a 2-month recovery. It's completely reconstructing your chest and your life and trying to figure out everything. It's a lot bigger, not commitment, but chunk of time taken out of your life to do. So it's a major surgery.
And more painful than an 18-gauge needle.
Way more painful than an 18-gauge needle. But yeah, I personally think about top surgery like twice a day. It's just something that lives within me. So
a couple of terms that I'm probably not as familiar with as I should be. You've been saying trans masculine versus trans man. Is there a difference, or what's?
It's like an umbrella term. So trans man implies binary. So I'm a binary trans man. Trans masculine.
Okay, what is that? What does that mean when we say binary?
So binary is that the doctor woke me up and, like slapped my butt and was like, this is a woman. And then I was like, no, this is a man, which is technically an opposite, like binary, male or female. Okay. And so a trans woman is binary, male or female, but non-binary people are the opposite of that. They have like all sorts of different things in between both, neither. That I'm not non-binary. I'm a binary trans person because I am male or female, and I am male. So when I say trans man, that means binary trans men, people who were born and assigned female at birth, and then they were like, I am a man. When I say trans masculine, that implies everyone who was born and assigned female at birth and then decides that's not for them, whether or not that's binary or non-binary.
Oh, I see. Okay, so it's an umbrella term.
So I tend to use trans masculine because that implies non-binary people as well.
So then you use the term top surgery, which is a mastectomy.
Yeah, it's a double mastectomy.
Double mastectomy, and then gender reassignment or realignment is that called bottom surgery?
It's called bottom surgery. Yeah.
All right. I don't know.
Good guessing.
Want to say it wrong.
Bottom surgery is usually referring, because there's, as well as I do, you're a medical professional. There's a whole lot of surgeries that you can choose from. So when people just say the surgery, you're like, which one, dude? There's like 7 of them. Which one do you want from me? Even if you're just talking about top surgery, there's multiple kinds of top surgery you can get. There's multiple kinds of bottom surgery you can get. And some people want one and not the other, and some people want both or neither. But it all just specifically refers to what you want to treat your dysphoria with, how you would like to do it,
And I know that for some male to female trans women, that might include facial reconstruction to
facial feminization surgery.
Facial feminization. Yeah. There's a whole bunch of different options, and again, this is the other thing I just want to mention too. If anyone's watching that is kind of has these dysphoria kind of thoughts, there are medical professionals, and I'm going to ask you, Adam, to send me those links to those medical professionals.
Okay.
Because there are medical professionals who are competent and can help you.
Yeah.
There is help, and we want to safely help young people, all people, with the right medical interventions. We don't want people trying stuff on their own. We don't want people trying hormone therapy or HRT on their own. I'm a big advocate, obviously, for medical professionals supporting our community through processes and treatments.
I don't know if people know that that is a thing that people do, like that trans people do, but that totally is a thing. I hate to kind of like, I don't know, like let the secret out. But when I was underage and all of my other, you know, trans masculine or like transgender friends that I knew through like the Utah Pride Center, there was a ton of like 18-year-old trans men that would go and they would get on T and then they would be like, oh, I'm non-binary, so I just need like a little bit of T to continue. And then they would like give the rest of that dose to an underage trans man. Like that was something that was super common in Salt Lake. That is something that happened all the time. Super duper common.
Can be dangerous, right?
It can be, especially like if you or me, you have a history of high cholesterol, heart attacks. If I was just willy-nilly taking T underage, that could kill me. What if I had like, you know, like a heart condition or a hematocrit condition or something like that?
Yeah, this is another reason why healthcare access becomes so important. If you had like consistent and general and you know, comprehensive access, including for the queer community, then we would mitigate these, you know, black market, if you will, treatments. It's you know, it's similar to another thing that I get really passionate about is termination of pregnancy, abortion. Right. When we make that, we don't allow access through legislative means. We don't allow access to that healthcare procedure, which it is. It's a healthcare treatment plan as well. And when we don't provide that access, then you end up doing things that are unsafe. Because it is a matter of life or death.
You don't get rid of safe abortion or safe transition. You don't get rid of abortion or transition. You get rid of safe abortion and transition. Because I might be getting a little bit personal here, but like I didn't have access to like a chest binder until I was 16, and that didn't stop me. My ribs are like permanently messed up because I was binding my chest with duct tape from the age of like 13 to 16. And as a kid, you don't know any better. You know, you think you see ace bandages, you see duct tape, you see like athletic tape or something like that. And you're like, this will work. This makes me feel good emotionally, even though it's like permanently messing up my body. Same thing with other forms of like corrective stuff. So like if people aren't going to be thinking about, oh, is this testosterone that I got from my friend going to kill me? They're thinking, my parents are never going to let me transition. I do it now or I die. And so getting rid of that safe access is not going to get rid of trans people. It's just going to kill trans people.
It creates a public health problem. I mean, if you want, I mean, a way to like manage this politically is that, you know, to talk about it from a public health perspective. So you have to promise us that as a medical doctor, as you kind of go through your career, that you, and I know you'll do this, is really helping, you know, with our institutions need to support this. And the other thing I want to ask, Adam, if there is anyone watching or a 10, 11, 12-year-old, 15, 16-year-old, or 25-year-old who is struggling, dysphoria, they're going in, you know, kind of in the black market to get treatment or to get relief. How do they get help? Where can they go for help?
I just want to say really quickly, my DMs are open. Like I that's something that I have put a lot of effort into, both in, you know, St. George and in Salt Lake. I was on the Utah Pride Center's youth planning committee for 6 or 7 years. I have resources. I am a resource. And if anyone needs anything, please talk to me. Because I'm in that position of privilege where I have access to a lot of those resources that underage trans people will not.
Adam, I'm old and I don't know what it means when you say your DMs are open.
My direct messages, like my DMs are open.
Okay.
Like Instagram, my social media. But also know that even if you're like, Adam is a weirdo, I don't want to talk to him, there's other resources. The Utah Pride Center in Salt Lake City specifically is a great resource. And even if they can't help you, they can refer you out. Their therapy groups are really good. I know Encircle exists in multiple cities in Utah. St. George right now has an Encircle house. We actually just did the drag show for Dixie State University where I won.
Oh, you did?
Yeah, I did win. It was super fun. But like we have resources here. We have access to things here. And if anyone needs anything, I would be more than happy to A, either direct you to a resource, or B, create a resource with you or help connect you to anything like that. There is hope. Yeah.
And Topic Discuss, this channel and all of my platforms, Topic Discuss is a queer community ally. I can tell you though, if you reach out to Topic Discuss and me, and I will absolutely help you, and I will probably send you to Adam.
Yeah.
But Topic Discuss is a safe place. You can DM, I guess that's what I'll say.
Yeah.
You can DM me.
Yeah.
And I will absolutely hold your hand.
Yeah.
Keep you safe.
I know underage, it feels forever. And that's because all you've known in life is, 15 years. For someone who's 45, 15 years is not a long time. If you are 15 years old, that is your whole life. And so the idea of having to wait another 6 or 7 years, another 10 years before you can start your transition, that's like your entire life. That's your entire lifetime again. And it seems so long. That's why when I was 13, when I was 16, I was like, this isn't going to happen. I can't make it that much longer, Even when I was, a freshman in college, trying to get a hold of this healthcare and being unable to access it, it seemed so hopeless. And I know that it's like kind of BS of me now that I'm, on this transition to be like, oh, you'll make it, you'll get there, but you really will. It's absolutely true. If you stick it out, there is resources that will help you transition. Like you can transition, even if you think that it's going to mess up your life, even if you think that no one's going to support you, you can do it. I promise you can. Like it is so much better on the flip side. It is so worth it. I feel like I've been living my life in 2 parts, and that the second part is just, even the year and a half that I've had is infinitely better than whatever life I was living before because of my transition.
So this is a perfect segue into a new comment that I want to share from someone we both love.
I love Doug so much. Doug actually dealt with me, and I do use the term dealt with because I was a force to be reckoned with when I was 18 in a Trailblazer Connections class, and he has just been my advocate from day one. He's actually the reason that I did early app to the U at all. He sat me down and he said, everyone's going to say that I'm crazy, but you should do this. You should put all your eggs in one basket. And it worked. And I absolutely attribute me getting into the U with his advice. And he is the ally that is needed within education and within the pre-med pathway. I don't know. I don't want to like cry on air, but like he is absolutely my mentor and I admire him so much. Thank you so much, Doug.
So Topic Discuss audience members are called Buttercups, Adam. So you're an official Buttercup, but I have I have Buttercups that are visually impaired. So I'm going to read this so they can hear it. Yeah. This is from Doug Sainsbury. Doug's a colleague of mine. We've worked together for a long time and a good friend. This is what Doug said. Adam, thank you for sharing your experience with us. I've always admired everything about you and hearing your transition story. I'm just awestruck. You are an amazing man. So I'm going to let you catch your breath, Adam, and we'll go on to another comment. So for the Buttercups, if you are using tea from the black market, ask your primary care provider for a blood test. Your doctor will want to help you, even if they're doing it they're resisting. If you're getting trouble accessing to medication, reduce the risk. I really appreciate that comment. I'll say this, one of the most important life skills that we can learn, and I'm hopefully any young people listening, is to learn to ask for help. Learn to ask for help, because people will help you, even if they're kind of jerks about it. People will help you. So we want to advocate for asking for help. Go ahead, Adam. You got a comment? Or
Oh,
are you
no,
just
I'm good. We're just
composing
vibing.
yourself? Okay.
Yeah, I'm just,
Okay. All right.
it's fine.
Chilling. So, Adam, I just also wanted to ask, this is more of an education. So you are on only testosterone, nothing to block estrogen or anything else, just testosterone?
Yeah, there is. So, I'm not a medical professional yet, but with female to male transition, you don't really need estrogen blockers because estrogen is kind of like not as powerful as testosterone. And testosterone can technically be converted back and forth to estrogen and estrogen to testosterone and so forth. So basically, by pumping like this testosterone in my body, it's just giving my body alternative directions to like help supplement that. When you are trying to block testosterone and injecting estrogen or taking estrogen pills, it's a lot more crucial to block testosterone and do a couple different medications. Because if you're just trying to compete the testosterone with the testosterone will always win. So
Yeah. Testosterone's well, and just a little bit of additional information for our buttercups joining us right now. In the developmental phase, when a fetus is developing, the X and Y chromosomes will come together, right, to make a male a male baby. But initially, the baby really does, the fetus starts out as female. And the Y chromosome obviously creates these additional, features and changes,
yeah,
but
SRI gene.
there is this capability of testosterone converting back and forth.
Yeah.
That's why another thing I'll say, well, I won't get into that in terms of or reversing a transition, but it is possible.
Yeah.
So Adam, or is there anything else that you'd like to share or that you'd like to talk about?
I think that the biggest thing that I want to put out there specifically into like the healthcare world is that there isn't a whole lot of visibility for trans people within like STEM and within healthcare, because they're usually just put off to the side as like, oh, queer people, specifically like POC and like Black queer people and Black trans people are more of like a humanities section kind of person. So you'll see like directors like the Wachowski sisters directing like The Matrix and stuff like that. But there's not a whole lot of representation for transgender people in STEM, which is why it's so important that I am kind of a little bit of a show pony when it comes to me getting into the U and like becoming a doctor and becoming a physician, because it legitimizes and facilitates a conversation about the fact that trans people are just as capable, just as professional, and just as good as cisgender people, which is just non-trans people, when it comes to like being in healthcare. And that like my transition is not like something that is like a risk for me becoming a physician, which is something that was told to me a whole lot growing up. It is just an attribute that, if anything, will help me better take care of my patients and better take care of my clients.
So one of the things that I hope that you'll also do, because we are behind in many things here in Utah. So if you are, I hope, willing to stay and practice in Utah,
yeah,
that kind of, that pioneering effort will help, create really a better future for everyone.
It's good and it's not. It's a double-edged sword for sure with pioneering, because it also means that you are the test subject and you are the representation of your entire minority group, essentially. So if I kind of mess this up, it's not great. Like I'm not saying there's not going to be like other transgender physicians, but it's really important for me to kind of be really strong about what I'm doing and my activism and really pushing for a ton of stuff, because right now it's basically me going into spaces and overhearing people being like, why would we have these resources for transgender people if transgender people aren't even going to be here, if they're not even going to get here, if they're not ever going to be in this space because they're just not welcome or they just won't make it here. And then I'm the trans person that's sitting there and I'm like, well, I'm here and I'm pretty sure I scored higher on the MCAT than you. So, yeah, I had that experience.
Do you want to brag about what you got on that?
No, it wasn't the best
Okay.
score, but it was definitely better than all the dude bros who were telling me that being trans was a liability. So, sorry.
I love
No,
it.
I was shamed aggressively by a good cohort, a good chunk of my cohort at Dixie State University with legacy applicants to the U, legacy applicants to medical school, basically telling me that I was a risk, that being transgender was a liability, that it was, not professional, and that it was going to make me look like, what is it, like a one-trick pony? Like, oh, I'm the trans physician, I'm like, everything that I do is because I'm transgender and I don't have any other attributes. I'm essentially going to get in on being the diversity hire. And I was ribbed really hard for it. And I had a lot of people telling me that I wasn't going to make it anywhere because I wasn't spending enough time studying for the MCAT. I wasn't taking off work for the MCAT because I was working 40-hour weeks and taking, 18 credits or whatever, trying to put myself through undergrad when a bunch of these snooty little legacy kids were basically being handed acceptance on a platter if only they would, take it. And so it was really validifying for me. And by validifying, I mean I laughed really hard and was like a little bit mean about it, to basically not only prove that I could be transgender and a physician, but to almost like not rub it in people's faces, but be like, that really sucks that I'm transgender and a physician, and that you are now being reduced down to being kicked out of like the early acceptance, and now you're in like the general pool. That really sucks. It's really validifying to prove that not only is being transgender not a liability, but it is something that makes me a better applicant. It's something that makes it so that I will be a better physician. So.
And remind us when you do start at the U.
Next August.
In the fall?
Yes, in the fall.
In the fall of 2022.
Yes.
Have you thought about your specialty?
Cardiovascular surgery.
Oh, wow.
Yeah.
Okay. Well, listen, Adam, this is, healthcare is what I do. I work for Intermountain Healthcare.
Yeah.
I work with Doug on the pre-med program. So I'm your advocate. We are working hard at Intermountain Healthcare to be much more inclusive and much more intentional.
Yeah.
So Topic Discuss is a platform for you too, Adam. If you want to come back, I'm sure
I would love to.
Our buttercups would love it. And we can actually experience the transition with you. This is a platform that you are welcome. We're just making you a lead buttercup.
Thank you so much. I love activism. I love advocating. And I, in my own way, do kind of love being a show pony because it shows all of the other, 14-year-old trans people out there that they don't have to settle for being treated badly, or that they don't have to feel like they're unprofessional, that they don't have to feel like they have to like hide being queer, hide being transgender, hide being mentally ill if they also want to be a physician. And that not only is it okay to be all those things and still be a physician, but it also makes you better at being a physician. It helps you treat your patients better. And so that's why I'm really big with activism and really big with like showing off my story and showing off my transition and stuff, because if it helps one person realize that they don't have to settle for like just being trans, that would be worth it.
How are your parents now?
I don't talk to them. Actually, once again, it's messy. It's messy. My parents have never called me Adam. They never will call me Adam. I've been kicked out of the house multiple times for being Adam. They do not fund my schooling. I've put myself through school. They love me. They like having me back for the holidays. It's actually kind of awkward. Yeah.
So they don't keep you out of the house?
They don't keep me out of the house, but they don't keep me there, And I think it's because they genuinely have been thinking that this is a phase, that, I'm a lesbian, which I love lesbians, but I'm not a lesbian. And so, I'm getting married to this cisgender man, and he is a bisexual man. And, he called me by my name and pronouns. And this is actually, going on this was a commitment because they don't know that I'm on T. They have been holding on to this idea that I'm gonna
your parents.
Yeah, my family, my entire family doesn't know.
Including, the whole family. All right.
Yeah, whole family and a good amount of professionals do not know that I'm medically transitioning. And I was, as I mentioned before, kind of not trying to keep it that way, but I knew that as soon as they realized that it wasn't a phase, that there was going to be a really big reckoning and I might never see my siblings again. Stuff like that. And so when you asked me to do this, I actually really had to make the decision of, well, do I want to face that right now? Do I want to wait it out until they're asking me, why does your voice sound like that? Like, what is my timeline looking like there? Like, am I going to have that reckoning before or after the holidays? Am I going to try and appear more feminine for the holidays so that it offsets my transition? Like, what am I going to do there? It's actually really awkward because my father works with Intermountain Healthcare. There's a huge chance he'll see this. There's a chance he will see this right now or within the next day. And so there's a chance that, because like most of my extended family is ER nurses for Intermountain or receptionists for Intermountain. That's my mom, or anything like that. They all are healthcare workers. And so there's a huge chance that this is basically my coming out video, which was a decision that I had to make when Dr. Davis put us together in that group chat and asked if I wanted to do this podcast. So.
Well, thank you for choosing topic discuss and your willingness to be open. One thing that I'll add, there is the gender dysphoria and transgender challenges they're far reaching. So as I experienced as a family member of someone who is transgender, I can remember how challenging it was for me to let go of, and we can have a whole other podcast on this, is for the family members, because you do feel a loss of the person that was there. And what I didn't realize is that it's not a loss. But that's what goes through your mind, right? But I can tell you, if your family members watching this of transgender family members, if you are, an ally or a family member, what actually happens if you stay close to your family member who's transitioning, you will journey with them, and you will never experience a loss. If you disconnect and then don't see Adam, if anybody from Adam's family is watching this, you disconnect and then don't see Adam for 18 months, you'll see somebody really different, and it will feel difficult and painful. But if you join Adam on the journey, you will not feel a loss. You will just be part of the journey with Adam.
Yeah.
And it will actually be really healthy. Go ahead, Adam.
Yeah, that's pretty much all I have. It's, even though I'm like everyone's, I made this post about like being trans and being in healthcare with like my professional photo that you used on the thumbnail, and talking about my experience as a queer person and integrating that with healthcare. Because, I'm a scientist, but I'm also, a drag queen. And so just talking about that and doing things like that, it went semi-viral. And so I'm having all these people DMing me, on Facebook that's like, I wanted to be you. I'm transgender and I wanted to go to medical school, but because of all these factors, I never could. You're living my dream. And now I'm like this, enigma. I don't know, like this one of the very first trans people to ever go to medical school in Utah, if not the first, if not one of the first in the US, to be out and to be going to medical school and to becoming a physician while openly transgender and transitioning.
And going through transition.
Yeah. Because what most people know is someone goes through medical school, they are a doctor, and then, they're 50 and they're like, oh, I've been a woman this whole time. And then they transition later in life. And so I'm kind of an enigma in the sense of I'm transitioning right now. Like, this is something that I'm out and proud about. And so it's kind of crazy being catapulted to semi, internet famous, and getting all these like DMs and being this advocate. And I'm 21. I just legally am allowed to like do things. Like I got my driver's license like less than 5 years ago. Like I'm 21 years old. And so it's a whole lot to be reckoning with right now. Going through second puberty, being this advocate, going to medical school, which is this crazy thing all by itself, and being 21.
So Adam, if it's okay, and maybe you tell me if it's not, but I think another clarifying point, and maybe this is where we can kind of wrap things up. By the way, if you're watching and you want to make a comment that we can share, please do. We're probably 5 or 10 minutes left, so get your comments out there. But human sexuality is not the same thing as gender.
Yeah.
And so I think it's interesting that you talked about earlier that you have a significant other. I don't know what you're comfortable sharing, but I think for education purposes, maybe if whatever you're comfortable sharing, what is the difference between your sexuality and how you identify sexually that's versus your gender?
So, wow, that is constantly a journey, constantly evolving. So I initially was, like a lesbian, but I transitioned socially pretty early. So like that was part of my journey to becoming transgender. So like I remember being like 11 or 12 and seeing like a butch for the first time, which is like a very masculine lesbian person, and being like, that's what I want. That's what I want. But what I wanted was the masculinity. But that I had never seen trans man. So I was like, okay, you can be masculine and a woman. And so I was like, that's good. But that was a stepping stone on my way to becoming a transgender man. I am proudly bisexual. And transitioning medically hasn't changed that at all. Some people it does. I don't know why. But I'm dating a cisgender man. I'm getting married to a cisgender man.
Congratulations.
Yeah, thank you so much.
Will you
but
teach the audience what cisgender man means?
Yeah, so I'm transgender man. I'm a trans is an adjective, I'm a brunette. I'm a transgender man. It's an adjective, and so cis means that you identify with the gender you were assigned at birth. So not trans. I'm trans, you are cis.
So I'm a cisgender man.
Yeah.
Transgender man. I've got a point.
Yeah, I'm a transgender man. And so my partner is cisgender. His name is Bruff, and I love him so much.
When are you getting married?
Next year, right before. We were actually trying to plan it around medical school, because I was like, well, if I don't go to medical school, I'll just do a post-bac in my PI lab with Dr. Douglas at the U, and then we can get married whenever, But if I'm in med school, we got to really plan for that, because I'll be in medical school. So we should be doing it sometime around next summer, fall.
So I think that's, you also mentioned the testosterone therapy has not changed your sexual identity or how you feel in terms of attraction. And again, part of that's because how complex human sexuality is, right? Human sexuality ebbs and flows. We are very unique in the animal kingdom too, as a species, where we probably can have even more fluidity with sexuality as a species. And so you're not feeling really any different? I've
been bisexual the whole time, so yeah, there's not really anything for me to change there. I know a couple of people who were like, oh, they stayed the same even though their gender changed. They went from being like a lesbian to being a heterosexual trans man, so they were still attracted to women the whole time. Or I've known people that have gotten on testosterone and they're like, oh wow, I am bisexual, or I am gay. Like, I am no longer attracted to one gender, I'm attracted to another, or they like change it. Mine did not. I was just bi the whole time. So
what connected you or attracted you to, what's his name again?
Bruff, Bruff. What
Bruff.
isn't attractive about him?
That's a great name.
Yeah, isn't it a great name? What is not attractive about my fiance? I don't know. That's a whole nother podcast, is me just being in love with this man. He is so funny. He is a great cook. He is a little bit of everything, you know. Our first date, I came over and I was like, "Oh, right, let's go on this date." And he was like, "Do you want to learn how to play Magic of the Gathering?" And that's actually it was the worst. It was the worst ever. And I went home after my date and I was like, he was letting me down easy. And he's texting all his friends like, "That was the best date I've ever been on. He seemed so interested in me." But yeah, we were kind of smashed together in life, super coincidentally. What draws me to him is that he is the best man alive. Sorry, you guys, I got the best one. But he is kind, caring, educated, leftist, super non-toxic, but very masculine. He's a big guy. He's like 6'4".
The thing that I love about this story, Adam, is that this is another area where we need to unravel, some of our ancient societal ideas about relationships.
Yeah.
Right. Because we sometimes just think that a relationship is just sexual, going to make babies, have a family.
Yeah.
But what you're talking about really is this very dynamic relationship that is, it's probably, sexual, but it's also intellectual. It's also, entertainment. It's also, you just are jiving for so many different reasons. Mm-hmm. And the gender identities and the sexual identities are really not even part of the equation of the relationship, right? Yeah. Am I saying that right?
Yeah. Like, I don't know, like you don't really, it's really secondary. Like when I am talking about my partner, when I'm talking about Bruff, like it is integral that, he's a man because that's his gender identity. It's integral that I'm a man. That's my gender identity. But I'm mostly thinking about the soup that he makes me. I'm mostly thinking about like our date next week. I'm mostly thinking about like he has a daughter that I'm technically going to be a stepdad for, which is going to be really crazy and new, because I'm kind of being thrown into parenthood. But I'm thinking about like our daughter, I'm thinking about stuff like that. I'm not once being like, I am a man now, so I must be in love with a woman and define my sexuality and be the patriarch of the house. It's very freeing actually to be transgender because suddenly none of those gender rules, none of those gender roles really apply. So it's just very easy to find what feels good, what feels fun, like where I can play with that and have that. I think you are muted. No.
Can you hear me?
I can hear you. Love that.
Well, I'm not really very technical, so I film on my phone, and if I get a phone call from someone telling me my warranty has expired, which just happened, then it like knocks me off. It knocks out my voice, but not the camera. But anyway,
that's so frustrating. Yeah, but yeah, that's essentially it.
Okay, so congratulations, Adam, on an incredible future.
Thank you so much.
It is so exciting. Medical school is on its way. Creating a family with Bruff.
Yes, coolest name ever. Bruff. I know.
Yeah, I just picture a big fluffy.
He is. Dog. He's a big fluffy man. I love him.
It's a fluffy name, and this is a platform for you. So what I'm going to do, Adam, is I'm going to leave this totally in your court. Topic Discuss is here for you. If you want to come on in future shows, just DM me. And then
Yeah.
if you have other friends that you want to introduce on the show, or others that would like to participate, or if you want to introduce us to Bruff, I'm at your service.
Thank you so much. I really appreciate this opportunity for activism and for advocating within this. We love Bruff and Adam. Power couple. Yeah.
All right. Well, that's all we have time for. We're at an hour and a half. Thank you so much, Adam.
Yeah.
I hope this was a good experience.
It was super great. I really appreciate
Okay.
you having me.
Well, I think that's all we'll have. We'll just say peace out. That's kind of how we end the show.
Thank
Thanks,
you so
Adam.
much.